fact, I think I'm rushing for this keynote address. I don't know, how to start, how to begin after lunch. And you had those steps also. Here, some thought I would like to share. But before I go ahead, many of you may not be aware of the organization which I represent. It's Services Export Promotion Council, a setup under Ministry of Commerce, Government of India. Established way back in 2006, the mandate was given to promote export of all the services, including medical value tourism. Now, initially it may have been sometimes approach towards promotion may be very much disintegrated. But later on, we realized that when we talk about tourism, it has actually 2, 3 more components: film tourism, medical value tourism. And medical value tourism itself cannot be seen in isolation. It's not about hospitals, it's not about the facilitators who might be bringing a lot of patients to India, but it's about the entire value chain, where you need to analyze the value chain, the journey of a patient from a given country to India, how do they come, and what kind of services they require. Not only the treatment, but that entire journey needs to be mapped. So all those things started coming up for discussion, and of course, like a lot of challenges, issues, the expectation. I'll try to be very brief in my address, and some food for thought and some new ideas. And I saw the Health Presso presentation, and something clicked, so I'm going to discuss that also. But anyway, let's begin with some data. And if I can ask the slides to, is here? Yeah. Just try to map in a very simple way, the MVT ecosystem, where you have hotels. That's very integral. In fact, DG Tourism and IRCTC, they were thinking to have a portal where they would have all the hospitals and hotels aligned with each other. A lot of work is required to be done, and in ministry, things don't move that way because so many other issues and challenges needs to be taken into account. We also understand about the expenditure and the institutions who are providing a lot of support for the medical value travelers. And insurance is one of the key concerns these days. Overseas patients coming to India, whether they are insured or not. So those things we are trying to handle. And then the information. Not only information about the hospitals, but also the credibility which can be built on the information. A lot of hospitals are doing their bit in getting the patients to India. But how many are having that credibility in the global market? At the same time, there are intermediates, mediators. They are also talking a lot. They are creating awareness. They are doing a great job. But at the same time, how do you differentiate between somebody who is genuinely creating a value for India's healthcare system, and at the same time, there could be many who might not be adding value, and a lot of negative perceptions might be building up. A few data, in fact, for me, it's very difficult to read from here, but I believe for everyone else, this is just a snapshot on where we are and what is the global potential. So at the center, you'll find India is ranked 10th out of 46 countries in medical value tourism by Medical Tourism Index. Unfortunately, the data is also one of the issues which dampens, or which actually doesn't give the very much, just-in-time kind of assessment. And that's where we have a long way to go. We are struggling with that. India has over 1,600 hospitals, and those are all NABH accredited. At the same time, we do have 52 JSI hospitals. We have seen certain increase in the number, but now when we analyze it with the competition what we are having, it's a matter of serious concern. this is the aim. Uh, what we expect to reach 13 billion by 2026. A long way. Right now, the data, like, you want me? Okay. Not much, yeah. So 2 billion patients visit India every year, and from 78 countries. So far, like when I discuss this with hospitals, they have been doing their bit. This data is collated from their feedback, but there is no strategy to look at the emerging area. There is no strategy. Individually, hospitals are doing, even doctors are a kind of, goodwill ambassadors. They're also doing their bit. But if we have to have a national strategy on medical value tourism, we need to have convergence of the data. We need to have the convergence of the thoughts of the Ministry of Tourism, Ministry of Commerce. I'm representing Ministry of Commerce. So we're trying to build that, but here the participation of hospitals is very much required. I feel like that's the sector which needs to understand the value which we create. I'll give example of pharma, and that's very important example. I've handled pharma for over 13 years in Pharmexcel, another export promotion council, and we tried to create that brand, pharmacy of the world. And during COVID time, you would have heard our Prime Minister talking about India as pharmacy of the world everywhere when we were, initiating our own exercise on vaccines, the delivery model as well as the manufacturing model. And that brand was built, initiated way back in 2009 or 10. It took 4 or 5 years, but there was a kind of, the entire industry galvanized together. That's what is required in healthcare. This segment of healthcare, where we are trying to attract a lot of overseas patients to India. How do we create that value? Healthcare has always been a very political subject, globally also, and more so when it is skill related. It's not manufacturing. A lot of intangibility is there, but at the same time, you have those tangible elements of a good hospital, good infrastructure, and definitely good word of mouth. How do we create that publicity? We also talked a lot about cost advantage. It may not remain the same. And we are seeing that we are losing our patients. Those who used to come to India are going to other places for very, very specialized treatment. They are moving out. And Thailand recently has emerged as a very strong competitor, Turkey. And in fact, UAE also has emerged as a very strong competitor. So we need to have a strategy, which area, like when we talk about pharma, we do know that for cancer patients, for liver patients, and for many other therapeutic areas, India has the answer to the world by providing very, very affordable medicine. And of course, up the value chain we are moving. What we are trying to do here in healthcare, that is one thought I'm leaving you all with. This is, I just mentioned about it. Certain areas mapped, the countries, and you see Thailand up there. India is, of course, they're providing a lot of services, a lot of therapeutic areas being covered. But we need to move up the value chain, and we need to have more hospitals, more, what do you say? When we analyze, like in India also, when we try to analyze number of hospitals and the patients, and here we have to cater to the overseas patients as well. How do we create that value and give them the sense of not only the cost effectiveness, but at the same time, the good care? Another area which has been added now and is very much in the focus is Ayush related therapeutic, and we sometimes call it alternative medicine system, wellness. So that's another area which is there we need to focus. Well, this is something which I have, like in my course of points I have mentioned, but I would like to say a lot of issues like visa, a lot of issues have been raised. Industry has been demanding uh, schemes like ACIS. But you see, the government is ready to provide all the support for two, three things: market access, global branding, and infrastructure development. And at the same time, very, very important, the new emerging technology. And that's where, to Mr. Manhas, like, why I was very curious. You talked about, creating value for the doctors. How do they communicate about certain cases? This is what we need to take the India story globally. You see, we are talking about branding. Then globally, we are creating a lot of value. We are going to various markets. We are talking about it. But, how do hospitals see value? So not only doctors, but how do hospitals get integrated into it? How every component, it's not only hospitals, it's, the people who are facilitating, how do they communicate? Because there has been good stories about liver transplant, and like knee transplant, like that. I visited sometime last year. I was in Sri Lanka. A lot of hospitals from southern part of India, Kerala, were there in Sri Lanka, and they were talking about IVF. And that story is not known in this part, and globally also. Many countries are not aware that there are extremely good hospitals in southern part, and they are providing those healthcare solutions which needs to be known to the world. So this is how we need to create value, I mean to say, by discussion and coming up with some recommendations, some thought process. And that's where like ACPC unfortunately was not too much forthcoming, but in the last 2 years we have tried. And we are trying to address this sector not in isolation. In fact, we have just engaged KPMG to look into every constituent elements of medical value tourism and find out some kind of solution and recommendation. On our part, just for those who are not aware, we have also initiated, earlier we did initiate called one market related program called India Heals. And FICCI also had been doing Advantage Healthcare. So there was a convergence last year. We changed the name and we thought to give a kind of, holistic view, and we call it Sanjeevani. And the first edition of Sanjeevani is going to happen in Chennai next month. I do have one small video clip if organizers can just run it. That will be an opportunity for all of you to come over there and meet a lot of facilitators coming from overseas, like close to 200. And we do have a lot of hospitals participating. Doctors are invited there. Can we run it? Yeah, it's a video. I've sent the Google Drive. Okay. Do I have that much time? Yeah, I just want to show. Okay, I think it's hardly 1.5 minutes, I believe, so you can see whatever I had to say I've mentioned. But I would really will be willing to take questions because, this area and the council's work has not been known too much. And we do play a very, very important role in promoting MVT. And we are looking forward to a lot of ideas. We are looking forward to connect with every hospital. We are looking forward to connect with, technology service providers. We do have a portal, and in fact, Ministry of Health and Family Welfare also was preparing a portal. In fact, I can give that example. Uh, uh, During COVID time, there was a portal to be created. Of course, they didn't launch it because of certain other reason. But way back in 2015, our Honorable Prime Minister inaugurated one portal, Health Tourism, which was being taken care by ACPC. Somehow, another duplicate work was being done, and we are trying to revamp it. That's why I don't want to show that right away. But a lot of, it talks about the entire value chain of a patient, the journey, the hospitals. Hospitals can provide their details on that. All the NABH hospitals are listed there with the contact details. A lot of ideas are there. A lot of inputs can come from all of you if you visit. Maybe like after some time, I'll be through at some other platform or through the contact details which I would request the organizers to share with me. I'll share those details with you. Thank you so much for listening, and believe it adds a value to all your efforts together. Thank you.